It has always been one of our most important responsibilities as we've worked together to combat the COVID-19 pandemic to look after our most vulnerable in our communities. And that has particularly meant the elderly, especially those who are in aged care facilities. In recent times, we have seen the Victorian wave of the pandemic have a very significant impact. The level of community transmission that has taken place there has meant that people have contracted the virus in so many different locations. And aged care facilities have not been immune to that. Where you have community transmission running at those levels, then people are going to come in contact with the virus. And they work in many different workplaces. And that includes aged care facilities, it includes working throughout the health system. That has had a very significant impact, not only on the aged care workforce, but it has also meant that the virus has been transmitted into aged care facilities. Now that is deeply regrettable, but with the scale of community transmission, it is inevitable. What is necessary and what is important is how we continue to respond to the challenge that presents. First of all, I want to reassure people that the critical impact of the COVID-19 virus coming into aged care facilities is confined to only a handful of facilities within Melbourne. There are more than 430 aged care facilities across the Melbourne metropolitan area. Less than half a dozen of those I would describe as being in a more critical situation, and only a couple of those in the most severe of impacts. More broadly, we're keeping a watch list of just over a dozen of those facilities that we're ensuring that we're able to move quickly if the situation deteriorates in any of those facilities. Beyond that, we are keeping a close watch, but I must say they're doing a great job, even those facilities, and there are quite a number of those where COVID-19 is present, but they're managing it well, using their professionalism and the staff who are there to provide great care to all of those involved. The steps we've taken over the last few days, particularly since I've returned back to Canberra, have been making a very big difference. The establishment of the Victorian Aged Care Response Centre has been very effective. That has brought together both federal government and state government agencies in health and aged care and emergency management, bringing them together, working with the Defence Forces where necessary to ensure that we're providing the support that is needed to get those facilities most impacted stable again and providing the level of care that is necessary, dealing with any issues as they come up and making sure we have a unity of effort across the many different agencies that provide care in this area. A couple of important decisions have been made, and I want to thank the Victorian Government and Premier Andrews for working closely with us to get this effect. The first of those was the decision to cease all unnecessary elective surgery in Victoria, in both private and public hospitals. This has been important because what it means is we've been able to get access to the private and public nursing staff to support the aged care workforce. The biggest impact, the reason we've had such difficulties in aged care facilities, has been the loss of the aged care workforce. When the virus has come through the workforce, entire staffs of centres have been stood down, almost immediately in some cases. That has had a devastating effect, having to attract new staff at short notice and to try to get them into those centres. That has disrupted the continuity of care and has led to some very disturbing and unacceptable outcomes. And we need to work even harder to ensure that that's not repeated. And so getting access to those additional private and public system nursing staff is going to make a big difference and already is. The support of those hospitals where those staff work is also significant because of this decision. It means we can transfer more of the residents from those aged care facilities to those hospitals. That de-stresses the situation in the aged care facilities most affected. But in addition to that, it means that those residents who have been transferred as patients into those hospitals are getting the care and support that they need. Another important job that we're doing is reinforcing the infection control programs within the aged care facilities. Now already, through the Commonwealth's support, we've already put in place training for over 150,000 aged care workers in infection control. We're refreshing that right now as we move across those centres, targeting those most at risk to ensure that those practices are being followed. And that support is being delivered in Victoria as we speak and will be rolling out over the days and weeks ahead. They've had the training, but we need to ensure that it's being followed. And infectious disease experts are assisting us with that program to assist the aged care staff to do the important job they do. On top of that, we're increasing the flow and distribution of essential personal protective equipment into the aged care facilities. We want aged care workers to be safe, and we want them to feel safe as well. We thank them for turning up to work every day, and when they do that, they deserve to have the support that is being provided to them with the protection equipment that is available. And that has been extended to those face masks that have the plastic covering that goes over the actual face mask themselves, the shields as they're known. We're increasing the supply of those also. So that should give greater confidence to that workforce to be working in those sectors. The other thing we've done is we're bringing in what are fast response teams through what is called AUSMAT. These are highly experienced medical people that have worked in many situations, not only in Australia, but in providing aid and support in many developing countries around the world. Now, these are teams of 7, and they will go into facilities where there is a critical need and to be able to take control of a situation and to stabilise and get the centre into the right situation where there's been a serious disruption. Now, that is prospective. That means we'll be able to apply those teams into those situations should the need arise going forward. That gives us another layer of defence to put the protections in place to keep Australians safe in our facilities. And I've got to say, one of the most important areas that we're working hard on is communication with the families. Now, for most families with Australians in residential aged care, you'll be having family in a facility that has not been significantly impacted by COVID-19 in terms of the disruption of care in those facilities. And that's welcome news. That's the majority, the overwhelming majority of those who are in the residential aged care system right now. But for those who are in the most affected centres, we're putting in place, and already have done this in centres already, outward calls being made by the government to the primary contact of residents in those most affected facilities. Now, in the Epping facility in particular today, I'm assured there will be outward calls to all of those families, and they'll be doing the best they can to ensure they make that contact and seek to make that contact with those families. So we are working on the communication to ensure that you know what you need to know. Those who are the primary contact point for families, then we are relying on to share that information with other family members. But keeping you informed of what's going on, I believe, is very important, and I've made that very clear. And the Aged Care Minister, Richard Colbeck, has particular responsibility for making sure that those communication plans are in place. So you can see there is a lot that is being done, but there is a lot that needs to be done. This COVID-19 pandemic is nothing that anyone could have predicted, and we have to deal with it as it moves and it changes each and every day. It will give us surprises. It will produce outcomes with responses that don't measure up on occasions, and this is deeply concerning to me, as I know it is to you. But the response to that is to get on with it, to keep looking for the solutions, to get the resources, to work together, to make sure that we can put in place the best response we possibly can. And that's what my government will continue to do. I know that's what every government around the country at a state level is working to do. I'll keep working closely with them. From time to time, there'll be things we disagree on. That's to be expected. But be assured that those disagreements don't get in the way of us working together. We all share the commitment to get this right and to keep our citizens safe. But to those of you, particularly, who are worried about their family in aged care facilities, know that we are doing everything we can to provide the care that you rightly expect to be provided in those facilities, that I would. Certainly when my father was in that situation last year, he got wonderful care. And in the vast majority of the cases, people can tell those stories. So we'll make sure that the lessons are learned. Where there are accountabilities, they'll be accepted, they'll be acted upon, and we'll continue to work together to keep Australians safe. Thank you very much for your attention.